Good afternoon. Today we are going to learn something about Indian medical graduates. You are going to become Indian medical graduates. IMG. There has been a curriculum reform in 2019 and competency-based medical education was introduced by the Medical Council of India. So why was it necessary to reform the curriculum from an old way to a new way? The tasks and functions of a medical graduate, we need to define them. And the competency they need to acquire when they become Indian medical graduate. There should be specific teaching, learning, attitudes, and assessment methods. They need to have knowledge, skills. There should be a change in their attitudes, and they should have some values. Goal. So we are going to produce Indian medical graduates who should have requisites that are knowledge, skill, attitude, values, and responsiveness so that they may function appropriately and effectively as a doctor of first contact of the community while being globally relevant. You have to provide quality health care according to international standards, and you will become the doctor of first contact. So what are the roles of Indian medical graduates? Clinician, lifelong learner, leader and team member, communicator, and professional. So there are 5 roles of Indian medical graduate. Now this competency-based medical education is a learner-centered outcome-based approach. So there will be multiple competencies which you need to acquire. And for acquiring each competency, there will be multiple objectives. And there will be assessment for each of them. So these are today's means. You need to treat patient with empathy, adequate care. And we need to unhide the hidden curriculum. Was it like this that before no professionalism, no leadership was taught? They were hidden inside the curriculum. Now we will unhide the hidden curriculum. You have to show interest to your patients, build them with empathy and adequate care. You have to heal your patient. It is not only treatment, it is about healing patients. And you will be the team leaders who will provide quality care to the patient, and you will work for welfare of human beings. The patients are ailing and you have to stand by them. So there comes the need for education of professionals. Intentions: to provide overview of theories and strategies to develop professionalism curriculum, to describe elements of formal curriculum for professionalism, to describe strategies to optimize informal curriculum. Now there are some newer assumptions. Aspects of professionalism, old assumptions and new assumptions. We will see them. Professionalism as a competency, professionalism in individual, and professionalism challenges. You will feel multiple challenges being a professional. Now there are some old assumptions. What are they? attitudinal competency based on character traits at entry level. The newer assumptions are multi-dimensional competency with elements of KAC. That is, knowledge, skills, and attitudes. Now, professionalism in individual physicians who labs are unprofessional. Dichotoms, competency fixed at graduation. These were the old assumption. Now, lapses occur in good professionals also. Competency follows developmental curve and shift over lifetime. You will be lifelong learner and transformational leaders. You need to change and make changes for providing quality healthcare and for the welfare of the patient. The patient should always get benefit and justice from your work. And you should do nothing to harm any patient. You should believe in autonomy of the patient. Whatever you do, you should not have some conflict of interest. The professionalism challenge, older assumptions were infrequent and unpredictable. Now we assume they are common and appreciated. Now comes to managing professionalism challenge. We have to do some things. Analyze option, take action, assess situation, identify option, know professional values. All these are interlinked. Developmental curve. You will not become an expert in a single day. First, you will be a novice, then competent, followed by proficient. Finally, you will become an expert. Now again, newer assumption. Responses to labs. Role of healthcare system and responsibility of stewardship. Responses to labs commonly relying on negative levels, sanctions, and threat of removal. There can be another approach. One is educational, using active targeted coaching, sanctions for those who fail to respond to educational approach, RCA. So you can educate the students. We can educate the students to improve their professional qualities. Punishment is not always necessary. You should get a chance to reflect on your activities. We learn more from our reflection. That is, what has happened and what will be the result of this and how this will affect me to provide quality health care in future. Until you reflect on your activities, you do not learn. So you should learn how to reflect on any activity. Now we come to role of healthcare system. Simple setting in which lapses occurs. We can do that. I have already provided you with some video clips I had prepared, so you can watch them. There is also a narrative provided to you, and you can see what are the lapses, and you analyze them and write the answers, please. Organization and operations of system increase likelihood of lapses. Changes in system can support professionalism. Say you are in a ward doing a duty. You are overloaded with work. You are having multiple duties at time. So there is a system issue. Say you are doing a duty. There is a sudden load shedding. So your patient suddenly became bad because there was no generator support. So there was a system issue. These can be a part which can be a system issue. So a change in the system issue can support professionalism. Responsibility of stewardship, we will discuss them as we move on. So there are some steps: physiologic, safety, belonging, esteem, and self-actualization. In this process, you will develop gradually. The variables influencing your professional behavior: some is your self-intent, self-efficacy, positive role models. There will be some negative influence also: burnout, personal distress, negative role models, stressful situations. All these will finally produce a professional behavior. Now you can see this here: expression of professionalism and the influences on professionalism. External environment, practice setting, training environment, interactions with care team, and physician-patient interactions. So there is a need for development of formal curriculum for professionalism. We have already discussed the roles of Indian medical graduate: clinician, leader, member of the healthcare team and system, communicator, lifelong learner, and professional who is committed to excellence, is ethical, responsive, and accountable to patients, community, and profession. So professionalism means a lot. So you see the baby learning something. Learning is not only taught or said. Learning is what we do ourselves, an active process, and it is not a product. You have to have some self-motivation for your learning. Learning is both emotional and an intellectual process. A process resulting in some modification, relatively permanent, of the way of thinking, feeling, doing of a learner. So this learning will bring a change in your attitude. Challenges of medical education today: too much information, too little time, too many students in crowded rooms, exams that discourage real learning. So you have to develop self-directed learning skills to become lifelong learners. What is relevant in medical education today may become irrelevant tomorrow. So you need to update your knowledge daily, and you have self-motivation to learn. So these are qualities of a self-directed learner. You can see here there are three domains of learning: the cognitive domain, the psychomotor domain, and the affective domain. The cognitive domain, you have got some knowledge. The psychomotor domain, you have developed skills. And the emotional component is the affective domain. So you have to be lifelong learners. And you have to regularly modify your learning to maintain these roles as clinician, lifelong learners, leaders, communicator, and professionals. Learning a process resulting in some change or modifications in the learner's way of thinking, feeling, and doing. More effective the learning experience, better is the learning. New experience is just a beginning stage. So you have come to this new course, you are learning something. This is the new state for you. Now, level of competence. You are in the first year, so you are gathering knowledge. That is, knows. Now, what will come next is interpretation of that knowledge. Then demonstration of learning, that is the competence. Then performance, integrated to the practice. Knows how, shows, does. These are the different level of competencies that you will acquire. So you are a novice, then you become an advanced beginner, a competent person, proficient, and an expert. So as Indian medical graduate, where you need to go, what the patient needs from a primary care physician. So what is that? It is competent physician. You can see the level what the patient needs: novice, advanced beginner, competent. When you will do your PG courses and finally you become a faculty or an expert. But now, what is your goal? Your goal is to become Indian medical graduate who will be competent physician of first contact to treat the patients. So will become competent. So this is the for the UG curriculum, Indian medical graduates. We have learned about the different levels of competencies and all competence, all domains to be achieved in parallel and not step by step. So over the years in the medical curriculum, you will reach different milestones, and assessment of those milestones will be done. And there will be alignment also, so that you can finally reach your goal. The behaviors of professionalism: teamwork, integrity, self-care and growth, compassion and respect for others, scholarship and commitment to learning, responsibility and sense of duty, accountability, initiativeness, concern for welfare of patients. You see, as professionals, you have so many roles. So what is professionalism? The conduct, aims or qualities that characterize a professional. A moral code is often the basis of professionalism. More than doing a particular type of job, but more about being a particular type of person. You need to have moral codes. Professionalism is basis of medicine contract with society. It demands placing interests of the patients above those of the physician. You have to always place the interest of the patients, not your interest first. Setting and maintaining standards of competence and integrity, providing expert advice to society on matters of health. Professionalism aspires altruism, accountability, excellence, duty, service, honor, integrity, and respect for others. So you can see what is professionalism. Altruism. This is the essence of professionalism. The best interest of the patient, not self-interest, is the rule. Your rule is not your self-interest, but the best interest of the patient. Accountability, required at many levels: patient, society, and the profession. We are accountable to patient to uphold the patient-physician contract. We are responsible to society for public health needs. Excellence entails that we have to acquire knowledge constantly to become lifelong learner. Commitment to excellence is an acknowledged goal for all physicians. We have to provide quality healthcare. For that, we need to become lifelong learners to maintain the excellence. Duty, acceptance of commitment to service. This entails being available and responsible when on call, accepting inconvenience and risk to meet the needs of the patient. You may be having some personal challenges in your family somewhere, but you have to take care of the patient when you are on call. You have to neglect all other duties. Your first duty is your patient. The patient is ailing and you need to provide quality care to your patient. providing the best possible care regardless of the ability to pay, and volunteering one's skills and expertise for the welfare of the community. These are your duties. Honor and integrity, highest standard of behavior, and refuse to violate one's own personal and professional code. You have to be fair, truthful, and meet all commitments, or at least try to meet them. You have to recognize conflicts of interest and avoid relationships that allow personal gain. And you should think in the best interest of the patient. You should have respect for the patient's families, nurses, medical students, colleagues. This is essence of humanism. Humanism, in turn, is central to professionalism and fundamental to enhancing collegiality among physicians. Due to an explosion in technology, changing market forces, problems, healthcare deliveries, and now bioterrorism, physicians find it increasingly more difficult to meet their responsibilities to patients and society. There are some fundamental principles of professionalism: patient welfare, patient autonomy, and social justice. Patient welfare. Physician must be altruistic, cornerstone of professionalism. Physician must always provide care that is in the patient's best interest, not his own interest. Care should not be dictated by any other outside force. Example, market, society, administrative agency. You have to stand up against those. Patient's autonomy. Physicians must be honest with their patient. Empower patient to make informed decisions about their care. We should respect the decision of the patients. Social justice. Physicians should promote justice in the healthcare system. Eliminate discrimination of healthcare delivery based on race, gender, socioeconomic status, ethnicity, religion, or any other social category. Now, the 10 professional responsibilities: commitment to professional competence, lifelong learning, maintaining knowledge and clinical skills. Professional organization must ensure appropriate mechanisms for physicians to accomplish this goal. Profession as a whole must ensure all its members are competent. Commitment to honesty with patients, informed consents. Involve patients in healthcare decision. Accidents can happen. Inform patients immediately. Commitment to patient confidentiality. You have to maintain confidentiality of the patients. Commitment to maintaining appropriate relationships with the patient. Patients are vulnerable and dependent on you, so never exploit them in any way. Not for any financial gain, personal interest. You cannot exploit your patient. Now you have got commitment to improving quality of care. Physicians must be dedicated to continuous quality improvement. Work together with the society and professional organizations to reduce your errors, improve safety, optimize outcomes, and minimize overuse of healthcare resources. Commitment to improving access to care. Objective of all the healthcare system is the availability of uniform and adequate SOC. Physicians should work to reduce any barriers which prevents access to healthcare based on education, finances, geography, and social discrimination. Entail promotion of public health and preventive medicine. Commitment to a just distribution of finite resources. We do not have infinite resources. So we have to justify how we have to distribute our resources. And for this, we need a collaborative atmosphere, commitment to scientific knowledge. This is a contract with the society that we will provide them with quality healthcare. So if we do not update our knowledge regularly and we do not practice evidence-based medicine, then this integrity will be lost. Commitment to maintaining trust by managing conflicts of interest. Many opportunities to compromise professional responsibilities may come on your way. There may be conflicts of interest, and you have to see them and try not to have any conflicts of interest and avoid them. Commitment to professional responsibilities. Expected work collaboratively to maximize patient care. For this, you need to develop leadership styles. You have to work in a collaborative atmosphere. A doctor, he can't treat patient alone. He needs sisters. He needs team members of other teams. May say, I am a surgeon. I need to do some operation. So first, patient comes to me. I examine the patient. I send him to some laboratory to do some experiment, investigation. I need help of pathology, biochemists. Then I send him to some radiology department to do some investigation. Again, I need radiologists. I am performing the OT. Before that, I need help of anesthetists. I need help of sisters. I need help of junior doctors. So it should be a collaborative atmosphere. I will be a leader, a member of a team. So I need to work with everybody in a collaborative atmosphere. Attributes. Healer, professional. Physician is a healer and a professional. They should be caring, competent, and respect patient autonomy. There will be some challenges when you do professional practices. There may be abuse of power, arrogance, greed, misrepresentation, lack of consistencies, conflict of interest. There may be many problems. Abuse of power. Arrogance. You may become arrogant. No, you can't be like that. There may be lying on your part, some fraud activities. So these have to be avoided. Drug addicted, alcoholic, mentally impaired physician. They may be unnoticed by the colleagues and all. So this should be done. They should be segregated, given some opportunities to rectify themselves. And they should, because they will not be able to take adequate patient care. Failure to fulfill responsibilities. This is the physician who is committed to doing the bare minimum. Takes least amount of history. Refills medications without reviewing charts. Does not return patient's phone call. Review charts rather than the patient. So you cannot see a chart. You have to see the patient. It is a human being you are treating. The physician who is too busy to fulfill his or her teaching responsibilities to residents or students, come late for rounds or conferences and shifts the care of patient to trainees, not yet prepared for unsupervised responsibility. So this should not be done. These are some professional challenges. You need to know how to manage them. Conflict of interest. Avoid situations in which the interest of the physician is placed above the patient utilization of service. You cannot have any conflict of interest. So we have discussed a bit about professionalism. Next day, we will go more into leadership. You can see here, there are some links given. You click on the links and test your scores. Here is another link where you can find a document I have already posted in your WhatsApp group also. Find out your leadership style. After you go through these 3 links, please respond to the link given below and finish the 3 assessments. Thank you. See you by next day with leadership qualities and assessment.